Okay, so it's chapter 12, primary assessment. So we made sure the scene is safe. Now we're actually up to our patient and we're gonna start talking to them and figure out what's going wrong, do our assessment. So we're kind of gonna do a high level decision real quick as to what approach is the best way to assess that patient. We're going to figure out also really quickly if the mechanism of injury dictates we should start worrying about the C-spine. We're going to see how alert and oriented our patient is. We'll start taking vitals, or at least checking the ABCs, and then start making priority decisions. I got a little cut off there. So basically in the primary assessment here, we want to find things that kill the patient really fast so that we can fix those things fast, okay? So the easy acronym to remember this is this ABC thing. So they have an airway. Can air get into their lungs? Or is that plugged up due to them choking on something like vomit or something like that, or blood? If air can get into the lungs, are they breathing? Are they actually moving air? And is their heart beating? Blood going round and round. So if you walk into a room and the patient is yelling at you to come over or something, or is otherwise trying to communicate, then you can pretty much assume that their airway is open, they're breathing, and their heart's pumping blood. Okay, so versus if you're gone to the scene and your patient's can lying face down on the floor, you don't know any of those things, right? So you need to quickly assess all of those. This doesn't have to be serial necessarily, so in other words, you don't have to do this, then this, and this. If you got two people, then you can, somebody's doing airway, somebody's checking a pulse, can divvy up the resources. If you're into a CPR scenario, we're now going to check for heart activity first, we're going to check for pulse first, and start compressions, then worry about the airway. For whatever 98% of our calls, we're going to do ABCs. And once again, the steps: walk into the room, figure out what your general impression is. Are they lying on the floor in a pool of their own blood, dying? Are they yelling at you? Are they awake, basically, or not? ABCs. And fairly quickly get a sick, not sick, do I need to hurry or not kind of response going. So general impression is that kind of sick, not sick when you walk in the room kind of thing. So if you walk in and they're pale and diaphoretic and sitting there tripod position, wheezing, and they just look like death, then that's a get moving kind of thing. And this isn't something that takes more than a couple seconds, basically. So what would be a general impression of this gentleman? How sick is he? Right here, so I heard. Say it again. Too many people talked at once, I didn't quite get it.
Well, initially he's in the supine position, and then you're gonna go up, and I would personally do the CAB because he doesn't really look like he has signs of life.
Okay, so what makes you think that? Just because he's laying back there?
Well, if you like walk in and he's like talking or like he's moving, then fine, but like initially from this picture, I probably would say he looks lifeless. He's just laying on the floor.
So what would you say his skin tone is?
Pretty
Skin
red.
kinda looks like
Actually
ash
seems pretty
color.
flushed.
Yeah.
I think it probably looks pretty normal for skin tone to me. So I bet this guy doesn't look like, not quite like death, I wouldn't say. Now, positioning, nobody, if he's like that in bed, maybe he's just sleeping, right? But in the middle of the floor, people don't just usually lie in the middle of their floor randomly. So something's going on, certainly. But just my initial looking at him, you're not seeing video of chest rise or something, right? Skin tone looks okay. You can't really tell. Eyes are probably closed. It's a little hard to tell in that picture. So things to look out for again, altered mental status. Are they unconscious? Are they babbling incoherently? Are they freaking out? Yelling at you? That pale, sweaty skin look? They have a knife sticking out of their head, chest. And then like specific positions indicating distress. So one of those is like that tripod position that I mentioned where you're kind of sitting and leaning over, trying to catch your breath. If you walk in and somebody's doing the universal I'm choking thing, that would be an indication of distress. Again, if they appear lifeless, check a pulse, start doing compressions. Mentioned respiration wise, most of the time, when you walk into a room, you don't really hear somebody breathing, right? So if you hear interesting sounds coming out of somebody's lungs, snoring, gurgling respirations, that might tip you off, something's going wrong. Smell of places. Okay, so that's general impression. Moving along to chief complaint. This is why EMS was called again, so whatever their complaint is. Then we're gonna do the just kind of quick and dirty mental status. So are they alert? If they're alert, then we're going to ask them the person, place, time, and event. Should be an event up there. So the 4 questions. It doesn't have to be right away, but at some point we need to ask them the 4 questions. If you walk in and they're not alert, but if you say, hey, how you doing? And they open their eyes and respond to you then that's a verbal response. If you walk in and they appear passed out, but if you give them a little sternal rub, and then they wake up a bit, that's a painful response. And if you walk in and you give them a little sternal rub, talk to them, they still don't do any kind of response, they're just unresponsive. The way we would document that, it would be there, whatever. Alert to verbal, or alert to pain, or alert or unresponsive. Then assess ABCs. And if they're awake and if they're talking to you, they've got ABCs. Otherwise, you're going to open their airway. check for breathing. Go along. If the airway is not open, then we'll do something about that. And that's chapters 9 and 10. If they're not breathing or not breathing enough, then we're going to help them breathe. That's chapters 9 and 10. Check for pulse. Look at their skin color. So this is pretty good pink, flushed skin. Looks decent. Look for any little pools of blood. If you find any significant bleeding at this point, you want to stop that, fix it as soon as you can. We're going to check a pulse. I may or may not actually count a rate. At this point, we're going to at least check to see that they have a pulse. If you can feel a quick radial pulse, you should be able to tell whether it's normal, so 60 to 100 beats per minute, or really slow, or really fast. Pretty common to kind of walk into the room and ask them what's going on and slip one of those little pulse oximeter things on their fingers. And then we're going to get pulse out of that and their O2 sats. Let's look at their skin. Are they pink, warm, dry, more flushed, pale, cool, clammy, bluish lips, looking like death? Again, if you find any issues with ABCs, fix it. Don't keep assessing, just fix it. So especially you start dealing with squirty blood like that, fix it. So by the time an ambulance gets there, this kind of thing is that level of bleeding and their blood is out. So we usually don't actually encounter arterial bleeding very often. The ambulance side of things, just unless some whatever happy coincidence and you happen to be really close to somebody that got injured or something when you're out driving your ambulance around. So after you've checked your ABCs, you got your general impression, you should have a decent idea of how fast you need to move with that patient, so whether they're stable, might be unstable, or unstable. So basically, how fast should we be transporting this patient? How fast should we be moving? If you decide they're a priority patient, then basically we're going to roll the gurney in there, stick them on the gurney, get going. The rest of what we're doing can wait for the ambulance. We'll do it in the ambulance on the way to the hospital. You gotta reassess because patients change over time.